Dear participants, I'm Stavros Stathopoulos, the coordinator of the Greek Specialty Group in Physiotherapy for Mental Health. It's my utmost pleasure to extend a warm welcome to each one of you to our webinar titled Physiotherapists as Sleep Health Promoters. Your presence at this webinar is greatly appreciated as we come together to explore the vital role of physiotherapists in promoting sleep health. Sleep plays a crucial role in mental well-being, and as physiotherapists specializing in mental health care, understanding and advocating for healthy sleep habits is paramount to our practice. I'm delighted to announce that we have esteemed speaker as expert Dr. CRISTINA FRANGE joining us today to share her insight, evidence-based strategies, and practical tips on how we can effectively support our patients in achieving better sleep health outcomes. Your participation in this webinar demonstrates your dedication to advancing the field of physiotherapy in mental health and your commitment to improving the overall well-being of our patients. Thank you for joining us, and I hope you find this webinar both informative and inspiring. I call for a short greeting the President of the International Organization of Physical Therapy and Mental Health of the Executive Committee, Professor Daniel Catalan Matamaros. Daniel, the floor on you.
Yes, thank you so much for this invitation. On behalf of the International Organization of Physiotherapists working in mental health, the international community of colleagues working in mental health physiotherapy, I would like to say thank you to Stavros and also to your whole team in the scientific section of mental health physiotherapy in the Pan-Hellenic Association of Physiotherapists for your active role in promoting this field internationally. You are not only working nationally, but also you are spreading the important role of physiotherapy in mental health beyond Greece. So that's why we are very grateful for your great efforts. And this workshop, this webinar we have today under the World Sleep Day, which is today, we think that this is crucial. Why? Because as the expert, Dr. FRANGE, will explain later, sleep health has two very important components. One is physical health, and the other one is mental health. And physiotherapists, we are the best health professionals to work in this interlink, mental health and physical health. So this is crucial to improve sleep disorders. So thank you, and we really hope that you enjoy this webinar.
Thank you very much, Daniel. It's an honor for us to be with us. So I call the President of the Executive Committee of the European Network of Active Living for Mental Health, Mr. Alexandros Economou.
Good evening, dear participants. As the President of the European Network of Active Living for Mental Health, ENALMI, it's my privilege to extend a warm greeting to each of you. I'm delighted to welcome you to the webinar titled Physiotherapists as Sleep Health Promoters, within is being held under the auspices of ENALMI. This webinar marks a significant step forward in our collective efforts to promote mental well-being through physical activity and healthy living. Sleep plays a crucial role in our mental health, and as an organization, we have a unique opportunity to advocate for and support healthy sleep habits among the people. I'm confident that today's presentation and discussion will provide valuable insights and strategies for incorporating sleep promotion into our practice. I encourage you to actively engage in this webinar, share your experiences, and learn from our streaming speakers. Together, let us continue to activate your better mental health outcome for all. Thank you for your participation and dedication to this important cause. Thank you for the invitation in this webinar.
Thank you too, Mr. President.
Thanks a lot.
On behalf of the Greek Deputy Minister of Health responsible for mental health, Mr. Vartzopoulos, I give you his greeting, but it's not possible for him to be with us because an extreme urgent meeting in the European Union about the drug situation not permit him to be with us. I call on the floor the Dr. Kaliroy Labridge, the Secretary of the Hellenic Society of Hypnology. It's a consultant in respiratory medicine, expert in sleep medicine, and we're working together at the same hospital.
Yes,
Dr.
hello
Labro,
from me. Yes.
Labro, yes.
Can you hear me?
Yes, of course.
Okay, great. So thank you very much for your invitation, and I would like to congratulate you today for this excellent webinar. And it is really a great honor and pleasure for me to be here with you today. As we all know, today is the World Sleep Day, so sleep is as important for good health as diet and exercise, and most adults need 7 or more hours of sleep each day. Good sleep improves your brain performance, mood and health, and also sleep helps prepare your brain to learn, remember, and create. Not getting enough quality sleep regularly raises the risk of many diseases and disorders. Some people have conditions that prevent them from getting enough quality sleep, no matter how hard they try. Those problems are called sleep disorders. For example, sleep apnea is one of the most common sleep disorders. And if those sleep disorders remain untreated, they may lead to other serious health issues. So make sure that you're getting enough sleep, and if you have problems sleeping, talk with your healthcare provider so they can run you some tests, including sleep studies. And personally, I strongly believe that the physiotherapists can play a very important role in promoting better sleep health. So once again, thank you very much for your invitation, and I wish you to enjoy the webinar tonight because, you know, it's 9 o'clock here in Greece. Enjoy.
Thank you very much. Now we call our colleagues, the president of the Panhellenic Physiotherapy Association, dear Petros Liberidis, for a short greeting.
Εγώ, ως πρόεδρος του Πανελλήνιου Συλλόγου Φυσικοθεραπευτών, θέλω να συγχαρώ το Σταύρο του Σταθόπουλου και το επιστημονικό τμήμα για την ψυχική υγεία, της φυσικοθεραπείας, την ψυχική υγεία. Και βεβαίως να ευχαριστήσουμε την κυρία FRANGE για την παρουσία της. Σήμερα αυτή η Παγκόσμια Ημέρα, όπως γνωρίζουμε, η Παγκόσμια Ημέρα του Ύπνου, γνωρίζουμε πόσο σημαντική είναι ο ύπνος στην ψυχική υγεία και γενικά στην υγεία του ανθρώπου. Σήμερα θα μάθουμε πόσο σημαντική είναι και η φυσικοθεραπεία στην αυτή τη διαδικασία της βελτίωσης του ύπνου και θα μάθουμε τις τεχνικές. Πιστεύω θα εμπλουτίσουμε όλες τις γνώσεις μας και βεβαίως πολλοί από εμάς πιστεύω ότι θα γίνουν σοφότεροι και περιμένουμε με αγωνία να ακούσουμε τα καινούργια δεδομένα και να συγχαρώ το επιστημονικό τμήμα και επίσης να ευχαριστήσουμε την κυρία FRANGE και να συγχαρώ να έχουμε και άλλες τέτοιες, να ευχηθώ μάλλον να έχουμε και άλλες τέτοιες εκδηλώσεις που δίνουν άλλη μορφή στο σύλλογο και προάγουν την επιστήμη της φυσικοθεραπείας. Καλή επιτυχία.
So I have to translate. The president of the Greek Physiotherapists, CRISTINA, give you his thankful so that will be with us, and he promotes to have more collaboration, and also to the other participants said that we know about how it's important the sleep and the sleeping disorders, but now we have the opportunity to know better and more about the role of the physiotherapists as health promoters. Okay, and for last, I call on the floor Jose Bagos, is the General Director of our Journal of Physiotherapy in Mental Health.
Well, first, thank you, dear colleagues. It's a pleasure to greet you in this World Sleep Day that as all my colleagues mentioned already, is so crucial for all our well-being in general. I am happy that we continue to create and share spaces like this that are aimed to strengthening the exchange of knowledge, experiences, research, and good practices in the area. I would like to take this opportunity to invite you all to write in our Journal of Physiotherapy in Mental Health, which is the first academic publication in this area, where we can share, for example, the importance of the intervention of physiotherapies in sleep, for example. So it is an important opportunity that we can share, strengthening research, share knowledge, and make this accessible to other professionals and physiotherapists. I thank the Greek Specialist Group and the European Network of Active Living for making this possible, this space and the journal as well. They both have a very, very important role in the journal. And I invite you to continue working together to strengthening the well-being of people from an integral perspective. I send you all an affectionate greeting from Mexico City and warm regards.
That's great. Thank you. So now I have to introduce our speaker, Dr. CRISTINA. Is a sleep physiotherapist working as a clinician and a researcher. She has earned her postdoctoral degree at the Neurology and Neurosurgery Department from Neurosciences program at the Federal University of São Paulo in 2022, graduated with a PhD in Medicine and Biology of Sleep in 2018 from the Sleep Division of the Department of Psychobiology of UniFesp. She is certified in advanced sleep training by the World Sleep Academy, World Sleep Society in 2023. Dr. Franz has presented on sleep and its relevance to physical therapy practice at national and international conferences. She was part of the team that presented a discussion session on sleep and physiotherapy at the World Physiotherapy Congress in Switzerland in 2019. A course on sleep and physiotherapy for Israel Association of Physical Therapy in 2020, and for the Slovenian Physical Therapy Association online 2022. She edited the books Clinical Cases in Sleep Physical Therapy 2023 and Sleep and Physical Therapy, a Comprehensive Guide for Practitioners 2022, both by Springer Publishing. She gathered physiotherapists from Brazil to discuss and deliver the practice recommendation for the role of physiotherapy in the management of sleep disorders, the Brazilian Sleep Association Guidelines 2022. A member of Brazilian Council of Sleep Psychotherapists 22-23, of the Brazilian Sleep Association, and member of the Health Promotion for Life and Work Network. She's a faculty of the World Sleep Academy from WSSS, of the Sleep Institute, coordinating the course Sleep Physiotherapy and Einstein teaching both in São Paulo, Brazil. Her research focused on non-pharmacological intervention to improve sleep disorders, specifically sleep apnea and restless leg syndrome, and how sleep optimization can improve rehabilitation outcomes. She loves to collaborate and learn nationally and internationally. She is committed to ensuring that patients with sleep disorders and with mental health disorders are treated more effectively and holistically. Dear Christina, it's a great honor to be with us. Now, we are here to hear you. Thank you again.
Well, thank you.
Okay, that's great.
Okay. Thank you all very much for the invitation for this talk. It's a pleasure and an honor to speak about something that I do every day, both in clinic and in research. Thanks to the Greek Specialty Group of Physiotherapy in Mental Health, especially its president, Dr. Stavros Statopoulos, a friend that has always believed in my work, is part of my work, and has always supported the idea of physiotherapists working with sleep issues, not only in the treatment of sleep disorders, but also the promotion of healthy sleep habits. Today, March 15, we celebrate the World Sleep Day, a day in which we raise awareness for sleep. This year, the slogan is Sleep Equity for Global Health. And now I'm going to present about physiotherapists as sleep health promoters. I'll take the question and answer them at the end, okay? Well, first of all, I must say that I have no conflicts of interest to disclose regarding this talk. And I want to start talking about sleep. So why sleep is so important for our lives? Back in the past, sleep was seen as a state between being awake and being dead, and no differences was seen between sleep and some other states, such as coma, stupor, intoxication, hypnosis, anesthesia, and hibernation. With time, sleep was discovered to be a behavioral state in which we are unresponsive to the environment and to another state, and we enter into another state of consciousness, being this behavior a reversible one. Yet, this phenomena that happens to all living species and occupies nearly 1/3 of our days, and why not to say 1/3 of our lives, is something of huge importance. But until now, we don't know exactly why we sleep and what are the specific functions of sleep. We already know that we cannot live without sleep, and that sleep is responsible, broadly speaking, for healing our body from the day we have lived and preparing our body for the wake state for the next day. Sleep is essential for many, sleep is essential for many vital functions, including development, energy conservation, modulation of immune response, cognition, performance, vigilance, psychological states, and brain waste clearance. That is, this last one being discovered about 10 years ago with the glymphatic system that only works like a house cleaning duty, only works during a specific sleep stage. So we need sleep to have this glymphatic system working. In addition, we have many investigations on this active process that is sleep, providing daily restoration due to the production of fundamental anabolic hormones involved in cellular growth, involved in regeneration, such as growth hormone, testosterone, insulin, ghrelin, leptin, to name a few. Therefore, it's reasonable to suspect that sleep impacts a broader array of peripheral tissues than the brain. In each specific tissue of our body, sleep seems to provide a temporal compartment to cope with the tissue-specific molecular consequences of being awakened, of wakefulness. Here is another point to consider. Not only sleep is important, but the relationship between sleep and wakefulness is imperative. This relationship we call circadian rhythm. So it's not just the sleep quality and the sleep quantity that are important, but the time of the day that sleep takes place is also of huge importance. Sleep is not only a passive process in which many systems are inhibited and our senses are diminished, reduced. Sleep is also an active, a very active state in which brain waves detected by EEG can be as much faster than the brain waves during the wake state. So it's a very active process. Having said that, Sleep is an active and regulated process with its own mechanisms, inhibiting some areas and activating others in different sleep stages. Non-REM and REM, that are the two main sleep stages that composes a sleep cycle from non-REM N1, non-REM N2, non-REM N3, and then to REM sleep stage. With these sleep cycles, they repeat during the night, composing what we call a hypnogram. We are going to get back to the hypnogram in a few slides. But sleep is characterized by a circadian behavior that has its internal and external cues. Internal cue could be a hormone like melatonin, and external cues could be like eating times or the time we perform exercise. So sleep has this behavior to happen almost every time, every day at the same time, in a healthy manner. Of course, this will also depend on the homeostatic drive of sleep. That is the sleep pressure that increases the longer wakefulness takes place. And consequently, there is an increase in adenosine, an endogenous hormone that promotes sleep. So when we have these two processes in tune, the circadian process and the homeostatic process with sleep, the circadian process will indicate that it's time to sleep, and the homeostatic process will indicate that there is an accumulation of the need for sufficient sleep to go to sleep. So the interaction of these both processes, they determine the timing of sleeping and the timing of waking up. We adopt some specific posture lying down to sleep. Have you ever thought about that? I always talk about this with my patients. Why do we sleep? Why do we have to lay down to sleep? We lay down because we have muscle atonia or hypotonia during some specific sleep stages. And we need our body to be fully supported. Not only the body, the mattress, but also the head. So we have the pillow. So other characteristics of sleep is the easy and immediate state of reversion to the active state. As I have said, we have intense cortical activation, specifically during REM sleep stage. This activation is so intense that we can see with the eye closed, we can see the eye moving, meaning that a lot is happening inside our brain and inside our body. In fact, REM sleep, or as we call R stage, the REM sleep stage is a stage in which memory consolidation happens, and also motor learning, and therefore might be interesting for us physiotherapists that are in a process with rehabilitation or with healing of our patients. For example, from a concussion or from a stroke or even from a fracture. We also movement during sleep, especially during N3 non-REM sleep stage in which muscles of our muscle fibers. That might be interesting for us regarding many types of exercises as it involves the musculoskeletal system. Finally, sleep is a self-regulatory ability in which we have a reduced capacity of feeling the stimuli, auditory and other senses. So we have this reduced capacity of feeling these stimuli from the environment. Okay, now that we know a little bit more about the importance of sleep, what sleep has to do with physiotherapy? Why us, being a physiotherapist, why do we sleep and care about the sleep of our patients? Well, I have more questions than answers here for you all, but is sleep important for bone and tissue healing? Is sleep important for relearning new abilities? Is sleep important for coping with pain or proper muscle contraction and learning of muscle sequence for a contraction? Is it important for rehabilitation, for recovery from neurological conditions, for preventing or even, why not, treating sarcopenia, and for growing? Why do we sleep so much when we are babies? Babies sleep as much as 18, 19 hours. Well, that's another history. We can come back to that later. But for now, we know that the answer is sleep important for all those things that we physiotherapists do? We know that the answer is yes to all those questions. We all know the definition of the World Health Organization for our profession, but let's have a quick look again. We rehabilitate motor function, movement ability, we relieve pain, we treat and prevent physical challenges, all somehow related to sleep. By now, you already figure out the important physiotherapy and rehabilitation process. And I have to say that I'm very happy to be here with you all sharing those things about sleep. Well, sleep quantity or the duration of sleep is important for our health. So one of the first things that we as physiotherapists, one of the first things that we can do with our patients is to ask about their sleep duration. Are they having adequate opportunity of sleep duration? Are they sleep deprived? Note that sleep duration decreases across the lifespan, being the dark blue the recommended amount. So we see that the dark blue is the recommended amount, and the light blue is the amount of sleep that might be appropriate for an age range. So having less or more sleep than these recommended amounts may be harmful for our lives. So this is from national, and I think that we all physiotherapists, we should have one hanging in our walls. But quality of sleep is also a priority. So we spoke about quantity, and now we are seeing quality of sleep. On the vertical axis, we see the sleep stages. So wake, N1, N2, and N3. These three here composes non-REM sleep stages, and then REM sleep stage. On the horizontal axis, we see the hours of sleep. So this is called a sleep handle. This represents the stage of sleep as a function of time. When we lay down to sleep, our brain states starts to slow down its waves. So we are awake, and the brain waves, they start to change in length, in duration, in frequency. And then we start sleep. A normal, let's say normal or healthy sleep is when we go from the wake state to N1, N2, N3, and then go to the one of the deepest sleep stage, that is REM, represented here in yellow. So when we go to these deepest stages, we have two very deep stages of sleep. One is N3, also called slow wave sleep, and the other one is REM sleep stage. The REM sleep stage is asynchronous and is also called a paradoxical sleep, as I have told before, in which our body is paralyzed and our brains is in a very active state. So this is called one sleep cycle, and it lasts for about 92 minutes. So as the night passes by, during one night, we have about 4 to 6 cycles, meaning that these cycles are repeating throughout the night. When we see this whole hypnogram, we see that in the first half of the night, we have a predominance of N3 sleep stage, or slow wave sleep stage. And in the second part of the night, we have a predominance of stage. But when we are sleep deprived, depending on how long it has been this sleep deprivation, I can start sleeping, entering directly into the R stage. Or when I have pain or make apnea during sleep, or have difficulty in beginning the sleep onset, initiating sleep, or maintaining sleep, because let's say of a hypervigilance state, I can have many arousals. We see here the arousals are here in the graph all the time that these lines are here at the wake. So when we have that, it shows that we are fragmenting our sleep, and it makes it difficult to sleep to consolidate and to go through all the sleep stages, let's say in appropriate amount, and letting sleep make its functions. So the hypnogram of a patient with pain or insomnia or sleep apnea or a fracture or a stroke will look very different from this one normal here. And we do have a lot of sleep disorders. We have more than 80 sleep disorders that can interfere with that hypnogram. So we have sleep-related breathing disorders, such as obstructive sleep apnea, which is alarmingly prevalent in the population worldwide. We have sleep-related movement disorders, such as sleep bruxism or restless leg syndrome, that is also called Willis-Zachbone disease. We have disorders of hypersomnia, such as narcolepsy, in which the individual have intrusion from REM sleep stage during wakefulness, and that really interferes with quality of life. We also have some circadian rhythm sleep disorders, as we see our adolescents having a social jet lag, and our shift workers, for example. We also have some parasomnias and insomnia disorders, just to name a few. So all of these disorders, they interfere with quality and quantity of sleep and interrupt the homeostasis of our organism, of our body. I brought some few examples. For example, some of our hormones deepen with the rhythmicity of our body, their circadian rhythm, such as cortisol and melatonin, to be produced and released. These two are completely dependent. Melatonin, for example, is completely dependent of the light and dark cycle. Testosterone, how not to talk about testosterone, so important for us, for our muscles. But testosterone has a robust rise following sleep onset and gets its maximal levels in the early morning during REM sleep stage. The nocturnal rise of testosterone is linked to the duration of the first non-REM period. And we can observe a robust rise in testosterone during a daytime nap, for example. In this graph here, we can see in yellow the control condition, and in blue, we can see that testosterone is lowering according to the REM sleep deprivation that is called here in an animal model paradoxical sleep deprivation. And it decreases with the longer duration of REM sleep deprivation. So a deprivation of 24 hours, 48 hours, 72 hours, or 96 hours. We can easily see that the testosterone levels drop. Another example is growth hormone. Growth hormone is increased during the first part of the night and is intrinsically to the sleep. We need growth hormone not only for the developmental process during childhood, but also, for example, for enhancing spinal cord damage recovery or increasing lipolysis and lean mass with the recovery of many musculoskeletal conditions. So in an observational research conducted with physiotherapists in 2015, patients with pain, headache, stroke, Parkinson's disease, and post-operative states, all of them presented sleep issues. So we have a lot to treat in these patients. And when the physiotherapists were asked in this investigation about sleep education, where did they have sleep education, if they had any, and where they think they should learn about sleep, we see here that most answers in black, so the black bars here, represents that sleep should be taught in PT school during graduation. Here this is an American study, but here in Brazil is not different. If I remember correctly, I had just one class of 1 hour about sleep in my school here when I was graduating. So I wonder how it is in Greece. So you have to tell me that later. By now, we have seen that sleep is important in quality, in quantity, and timing when it happens in the 24-hour cycle. we have also seen that sleep has everything to do with our job of rehabilitation and with physiotherapy in some very brief examples that I brought. Now, let's have a look in the science, what the literature brings to us behind the sleep and physiotherapy. The idea of physiotherapy and sleep together, or sleep physiotherapy, started appearing in literature at the beginning of the 90s with the work of some physiotherapists such as Dr. Janet Besner and Dr. Stanley Coleman. In 2017, sleep was considered a vital function for activities of daily living by the American Association of Physiotherapy, based on a guide that they released 2 years before in 2015, focusing on health and well-being. From that time, from now, many cross-sectional investigations and scoping reviews appeared at literature, showing some sleep disorders and what physiotherapy could do and as a diagnostic and treatment. So this movement has already been happening in many places of the world. In 2020, the American Physical Therapy Association launched a position stating that physiotherapists could screen for sleep dysfunction, identify impairment related to sleep dysfunction, work with sleep treatment, education, health promotion, and refer patients to sleep specialists if needed. From now on, a lot of investigations have been appearing in the literature. So in the end of 2022, we launched the Brazilian Association Sleep, by the Brazilian Association of Sleep, the physiotherapist's guideline that is freely available for everyone in the official journal of our association, the Sleep Science Journal. So we gathered 23 physiotherapists from different regions in Brazil, and we discussed about our profession, the regulation, how to approach patients, what are the physiotherapeutic objectives for sleep-related breathing disorders, insomnia, circadian rhythm, sleep bruxism, and restless leg syndrome. We summarized this evidence and we tried to write some management protocols and their recommendations. And this happened because we felt the necessity for all of us to speak the same language when treating a patient with a sleep disorder. So this Brazilian consensus of sleep physiotherapy focused specifically on some sleep disorders. We need now to focus on sleep health. And I'm completely open to new investigations, and I would love to collaborate with you all. In 2022, we launched the Sleep Medicine and Physical Therapy book containing the basic of sleep and introducing the rationale for physiotherapists to work within the sleep field, in a chapter that Dr. Stavros wrote with us. I find this book very cool because we have a transdisciplinary work with physicians, dentists, speech therapists, psychologists, explaining that explaining the sleep diseases, followed by a chapter written by the physiotherapists explaining the physiotherapeutic approach. So I strongly recommend you to have a look at that. Last year in November, we launched the second book, this time written by physiotherapists from all over the world, from California to Japan and New Zealand, with a preface, a foreword from Dr. Meyer Krieger, one of the pioneers in the sleep field from its beginning. Here in this book, we present possible treatments, the hands-on approach to learn with and from different points of views and different cultures. So we have many people from all over the world that wrote a clinical case, how he or her conducted that case of the patient to improve the sleep of that sleep health and the sleep disorder of that patient. But what literature are starting to present now, moving from cross-sectional studies to randomized controlled trial, is the effect of physiotherapy modalities, the physiotherapeutic treatment in sleep diseases and disorders. Here we see some examples for obstructive sleep apnea from our group, and from Dr. Rodrigo Torres Castro from Chile, and from Dr. Paneroni's group from Italy that was very recently launched. For insomnia, here we have one that was from our group about exercise to treat insomnia, and we also have this last one from Dr. Catherine from the USA on the treatment about insomnia and pain, and this very intrinsic relationship about pain and sleep. And we also have an investigation, a recent investigation for treatment of physiotherapeutic treatment for narcolepsy with Dr. Hagi Tadros' group from Ireland. So we see that we have a lot of physiotherapists around the world investigating, treating, and researching about sleep and physiotherapy. Very, very recently, an investigation from Dr. Sieng Sukon from USA showed us that a single remotely class of sleep education provided by physiotherapist students, provided for physiotherapist students with knowledge about sleep, changed their belief about sleep. No doubt that this will change their practice, and they will learn more and more how to deal with the sleep disorders and with the clinical practice. And from where to start? Okay, I know this is too small. I don't expect you to read this, but I just want you to know that we have a decision tree to standardize the patient care in sleep physiotherapy. So we can follow this tree, which will help us, especially those who are beginning to be a sleep physiotherapist, and also for those ones who are already practicing. This will help systematize the care, the physiotherapeutic care. So I know it's too small here, you can't read it, not right now, it's not my purpose to go through this right now, but you should have a look at this investigation. In addition, from the Brazilian guideline that I just spoke, As I have previously said, we have reviewed the latest evidence on treatment for some sleep disorders. Here we see an example of treatment for restless leg syndrome, which is a sleep and a circadian disorder that causes a very strong urge to move the legs, causing an uncomfortable feeling in the legs prior to sleep. It typically happens in the evening or at the beginning of the night when sitting or laying down when we start to relax. Movement eases this discomfort for a short time, but we need to sleep and we have to move to get some relief. So it interrupts and delays our sleep onset. So just to tell you that we have summarized the evidence until the end of 2022, the physiotherapeutic modality, and for example, here you see the acupuncture, the physical exercises, and you see what modality was used, what population was used, what parameters the investigations conducted, and what were the outcomes, if it improved or not, each of the outcomes investigated. We also have detailed anamnesis followed by evidence-based physiotherapeutic treatment, in this case here for restless leg syndrome. So we have the anamnesis, we have the site of discomfort, we have the complaints that we must ask for the patient, we have clinical evaluation, and in case the patient presents all of these, we have to refer for medical diagnosis. In cases they already have this diagnosis, we can have the physical therapy, and here are everything. So we have this for all those diseases that I mentioned previously for you. For sleep breathing disorders, insomnia, restless leg syndrome, sleep bruxism, and there's another one that I forgot, but just have a look at that. Finally, we also have the recommendations of clinical practice and future research on physiotherapeutic treatment. Here again, restless leg syndrome is the example, but we have this classification by the strength of recommendation taxonomy that varies from A to C, being A, an evidence-based with outcomes centered in the patient, B, meaning evidence-based outcomes centered in the disease, that's completely different focus, and C, low quality of evidence, meaning that we need, look, we have a lot of work to do. We need to investigate it. We need to design randomized controlled trials to check these, or if these or if that specialty or modality of treatment that we don't have evidence-based can support the recommendation of this practice. So we already have this all. Having said all that, it looks like we've been in the sleep field for a long way, but the truth is that the sleep physiotherapy is on, let's say, on its embryonic stages, and there's a lot for us to do. We just have to start, and from where? Attending courses, webinars, seminars, discussing our clinical practice. So I think that all of you have already started. So welcome to this journey. we physiotherapists, we are sleep health promoters by nature. Thank you all very much for listening to me, for listening to all these ideas, and have happy World Sleep Day. I mean, in Greece, happy World Sleep Night. Here in Brazil is still afternoon, so I have the whole day ahead. I'm open to questions.
Thank you very much, Christine, for your presentation. It's really, we appreciate it. We are focused on our topic. And now, I think that we have time to clarify, to ask, to propose something to be better in this area. So, raise your hand, and we are here.
Well, I have a question. I wonder, how is sleep education in Greece? If you have any at PT school, or if you have courses, education, training after PT school, how does it happen? If I am a physiotherapist in Greece, how do I learn about sleep?
We have not any courses in the physiotherapy studies in the universities. So the physiotherapists can learn about or a master like we have Dr. Labro in the University Medical School of Sleeping Disorders. I am delighted there that I'm teaching the ergonomy of sleep. And of course, by training, by seminars, etc., etc. It's a new area in Greece, the role of physiotherapists for the sleep and the sleeping disorders, of course. But we try step by step. One of our steps is this webinar. Years before, we have another webinar with CRISTINA Staub. We know each other. And we are, this is the opportunity to have a brainstorming how to create. For example, as for the IOPTMH, the International Organization for Physiotherapists in Mental Health, we have the policy statement for how we can educate a physiotherapist in mental health in bachelor, postgraduate, master, post, etc. Unfortunately, we have not, neither from the World Confederation of Physiotherapy, especially, we need CRISTINA to create better policy statement in our networking in sleep disorders that we have to discuss on that. And for this way, we can have the same language in all over the world. But in Greece, we are in our first steps. And thank you to participate in this path.
Yeah, here in Brazil
Yes.
is quite different. Here in Brazil is quite difficult too.
I guess. Yes.
I have a question. First of all, Dr. FRANGE, really, your talk was really exceptional. And my name is Dr. Lampro. I'm a consultant in respiratory and sleep medicine. And I'm on this field of sleep, I mean, since ages ago. I mean, this is my expertise. So first of all, really thank you very much for being here. And I have to thank Dr. Stathopoulos for this great idea. I was really impressed to see how many things the physiotherapists can achieve in sleep medicine. And I was really impressed regarding the fact that you mentioned that we can treat RLS with physiotherapy. I mean, for me, it was the first time that I heard of something like that. And I was extremely impressed, to be honest. And thank you really very much.
You're welcome. Thank you very much for your insights, Dr. Lampro. This is something kind of new to all of us, and even for me, but this is something that I learned with practice. So just let me tell you very quickly, I was a physiotherapist, just like everyone else, and I started in my clinic attending chronic pain. And I attended pain during years. And suddenly, I don't know why, I realized that almost all the patients that I was attending, they had a sleep complaint. And like a light turned into my mind, and I said, sleep has to have something to do with pain. So I look at here in Brazil, we are fortunate that we have two big sleep group of researchers, mainly physicians. And I looked for one of these groups, and I entered one of these groups. I had just finished my graduation in physiotherapy here, and I started investigating with them. And I realized my first investigations on sleep were about sleep and pain. And that made me think very common for the physiotherapists to treat inside the sleep medicine. Here in Brazil, the physiotherapists are also respiratory therapists. So this is something very easy for us. Physiotherapists in Brazil can easily treat sleep apnea, for example. So I thought, why not treating other things? And I entered a group of physical educators here in Brazil, and I learned a lot with them about the muscle and the anabolic and catabolic states and all of that. And all of that depended so much about sleep. And I decided this is something that I need to study so I can understand my patients better. So just to have a picture, how is sleep physiotherapy in Brazil nowadays? I'm struggling every day to make everyone understand the importance of that. But I here in my office, I receive patients mainly to treat obstructive sleep apnea and central sleep apnea and other.
Can I ask you another question? Sorry to
Yeah,
interrupt you
sure.
regarding sleep
Yeah,
apnea,
that's
because
okay.
you know most of our patients, we provide them with the CPAP machine, and the main issue with the CPAP treatment is the fact that they cannot tolerate it very well. And so your patients, I believe that before coming to you, they have a CPAP treatment, or they start treatment for OSA before the CPAP.
The CPAP is the gold standard treatment for obstructive sleep apnea. So mainly what we do is to make them adhere to CPAP treatment.
That's brilliant, yes.
I think it's the same thing over there. But sometimes the patient comes here just with the polysomnographic examination, and they doesn't even know what CPAP means. So it's my role to make an interview, and my first appointment with the patients lasts 2 hours, and everyone says, oh my God, 2 hours. Yes, 2 hours, because the first hour, I'm symptoms about the complaints that he brings to me, and what is the relation of that complaints with the disease, with the silent disease that is obstructive sleep apnea or central sleep apnea, for example. So I make him understand that he needs treatment. And then in the second half of this appointment, I present him to the CPAP. So he lay down in my office and he tries different masks and he tries the PAP pressure, and I'm behind him explaining and explaining and explaining. So with a week, they come back and I keep explaining. So these patients, I have a very close, it's like hiding a bike. So I'm showing them where are the steps and what velocity they can hide the bike. And then when I see that they are ready, I'm just going to put my hands up and they are going to hide the bike by themselves. So it's a hard work, but I like to be very close to them. With that, I have a pretty good CPAP adherence here in my office. Of course, CPAP is not for everyone. Some people, it's not. So we have other treatments. So I have speech therapists that works together with me. I have ENT that I send the patients. I have dentists to work with mandibular advancement device. So I think it's something that we should understand with the patient, and if he is the patient, he or she, if they are open to the CPAP treatment.
Okay, thank you. Good
You're
to know what
welcome.
happens
So,
abroad. Thank you.
I saw a lot of questions on the chat.
Okay.
Oh, I think it's better the colleges to raise up their heads so we can have directly, or they prefer to learn by that. And I have to notice if someone of you needs a certificate of attendance, I sent on the chat the appropriate form, so please fill it, and after we can send you. Mrs. Fotiadou. Eleni.
Hello, for me. I want to ask, after a heart attack incident that treated by surgery, can a person have chronic insomnia? Is the surgery, is the fear not to happen again, or is the heart attack problem from the blood, I don't know, something, dysfunction?
Well, I don't have an answer for your question, I'm sorry, but I think insomnia, we have two kinds of insomnia. Let's say an insomnia disorder, that is something that happens, is a difficulty for initiating or maintaining sleep or waking up too early. That happens almost 3 times a week for at least 3 months. This is chronic insomnia disorder. And I can have insomnia symptoms that is in a short term. So if I'm going to have a huge surgery that my life is at risk, I may develop insomnia symptoms. If I don't treat those symptoms, with time, I can develop the insomnia disorder. So this, I think from what you said, that this might be more related to hypervigilance, to ruminating thoughts, to anxiety related to the surgery. But we have to check all the background of this patient, how was sleep when she was young and things like that. What kind of medication she is in, because the sleep could be, the sleep disorder, the sleep complaints that she's presenting now can also be related to the medication, to the pills that she's taking because of the surgery. So I'm not sure exactly what is she developing. I need more information on that to say something more, but for sure she needs your help to overcome these sleep problems.
The person that I talk about, it had for 3 years continuing insomnia. They asked the doctor what I can do. She take, no, you are okay, no worry, everything is fine, it will be okay, don't think about it. And the pharmacy shop gave him Xanax every day without a prescription. And after that, he led himself to suicide because he wants just to rest.
Mm-hmm. Insomnia can be treated by the physiotherapist with exercise with exposure to bright light. But the gold standard treatment for insomnia is CBTI, that is cognitive behavior therapy for insomnia. So if this patient wants a non-pharmacological treatment, I strongly suggest you to provide her psychologists that work with cognitive behavior treatment for insomnia over there. And
okay.
we know from literature that the CBTI treatment is even better than medication.
Unfortunately, another person that I have like a patient, I said, okay, go to the psychiatrist, and they give them only pharmacological. I talk about CBT, and he said, I went there, but okay, they said me that I'm for the doctor, not for them. I don't know. Okay, in Greece, it's a very different situation.
It's not only in Greece. I think this is something worldwide.
A lot of things. Now, I think Mr. Link, I saw the chat. Can you speak on us, Mr. Link? Okay. Mr. Baroutas, Christos.
Hello. Thank you for the presentation. I have a question. Is exercise better to happen before or after sleep? So it's in the morning after you wake up or in the night before you go to sleep? What's a better way? Thank you.
It depends. Oh, thank you for your question. It depends on what you want with exercise. So I think you asking if exercise. Well, we all know that exercise has a good influence on sleep, but we don't have in literature, we don't have a consensus on about what time exercise might be performed in order to have a proper sleep. Some people like exercise in the morning, some people in the afternoon, and some people in the night. When we have the sleep hygiene rules, one of these rules states that exercises should not be done 4 hours prior to sleep because it can stimulate other senses and make you not go to sleep. But the thing with exercises is that we have different types of exercise. So think about swimming classes or hiking or yoga or Tai Chi Chuan. So they're all different kinds of exercise, have different duration, frequency of exercise. We have exercise that are performed with loud music, exercise that are performed with very bright light. So all these variables, they influence sleep. So if I go and I perform exercise, let's say indoor class of biking, spinning, for example, with very loud music and bright lights, what I have is an excitement. So this might not lead me to sleep very quickly. Some years ago, well, almost 20 years ago, we had here at our university, and I've seen Dr. Sandra somewhere here. She was from our group here from Brazil. And we had investigation trying to see if exercise performed right prior to sleep could interfere with sleep. And the results were negative. So the patients, they did, I remember it was strengthening resistance exercise really prior to sleep. And that didn't influence in a negative way sleep. So this is a question of a million. We have a lot of variables that we need to understand better before we can answer this.
Okay.
I hope I have
Mr.
answered your question.
Αναγνώστης.
You're welcome.
Χρήστος Αναγνώστης. Okay. George Pehli.
Hello, everyone. First of all, thanks a lot for the presentation and the whole conducting of the webinar. So my question is there any specific position that it is advised for everyone to sleep that is supported by literature? Or should we more follow the thinking of like just take whatever position that you're feeling comfortable just so you can sleep?
Yes, thank you for your question. The best position to sleep is the one that you feel most comfortable. You have to, what we need during sleep is spinal alignment. So we need to have a good mattress and a good pillow. But this good mattress and pillow, it will vary a lot from patient to patient. So there is a lot of investigations going on regarding the sleep posture and the sleep mattress and pillows and temperature and lots of things. So the best position is that position that the patient feels comfortable and has no pain when he wakes up.
So I
Okay,
can add,
thanks a lot.
Christina, I can add, that's my topic in the university, is the ergonomic of sleep. We have also a position that we can use when we have a disease. For example, there is a position that they find for the hypertension. It's not a comfortable position, but they find that's a good to control the hypertension during the sleep. There is position that we have problems with the, for example, for the lung diseases or with stomach diseases. So depends a lot of, first of all, from the disease, and second of the how comfortable it's needed for our, for us, for patients, for everyone. I think in the chat there is not any question. So I can repeat that if it's needed a certificate of attendance, there is the form that I write you in the chat. Dear Christina, it was really a great pleasure for us to share all of this information, your experience that is great. I invite all the colleagues that have interest to take a look of your books because it's real, the books that we needed to start to study about the sleep and the correlation with the physiotherapy daily practice. So have a nice day, Christina. Good night to everyone in Greece and to the other part of the world that I saw that we are from here. Have the rest day. Be productive and of course to have a real good sleep.
Thank you,
Thank you,
Thank you very
Thank you.
much.
Thank you, Christina. Thank you very much.